Well, the coronavirus has pretty much single-handedly done what social justice warriors would love to have accomplished, or at least love to accomplish in their lives, and that is cancel a whole year. Hello, this is Mara Jade, and I'm normally here with another video on either pop culture related news or social commentary related news, but every site I go on, you see either a movie, a game, a convention either being delayed or flat out canceled. So really nothing to talk about other than this disease, because that's all the news media is talking about. That's the panic the news outlets are instilling within primarily the US population and causing panic buys of toilet paper and ramen noodles of all things. So basically they're going to not exactly starve to death, but they're not going to be as well nourished as they would like. So what use is that toilet paper going to be? I don't know. But anyway, so rather than, as citizens, doing our own due diligence as rational human beings, as people should, they buy into the hype, they buy into the over-exaggerated nature of this illness that's being reported by the media and then compounded by the government declaring a national emergency, rather than listening to actual doctors or without actually looking at the actual CDC's website that I have up here right now and looking at what the CDC says. Basically, the coronavirus, if you were to look up the coronavirus, it has been around since the 1960s. It has been around for nearly 60 years. It is part of the same family as with the common cold. The reason there is panic now, other than the fact that you have the twofold nature of China not revealing the first case when it happened back in November, actually, of 2019, but then you have the media, again, over-exaggerating the panic caused with a mild virus. It is basically most people who succumb to this succumb to symptoms much like the common cold or flu. And a lot of them is mild. And like with the common cold or flu, those who are more susceptible are the elderly and those with underlying health conditions such as deficient immune systems or other heart, lung-related issues. Do I mean to sound callous when I say that? No, because no one wants to see a family member who has those conditions get sick like this. But to panic buy, to go around wearing masks, face masks, depriving hospital workers of those masks because they're the ones who truly need those, and latex gloves, you are buying into the exaggerated fear instilled by the media. Case in point, look on the CDC's website, okay? Look at their website. How it spreads. This is the coronavirus, how it spreads. Currently, there's no vaccine. I'm going to get to that point because I'm going to talk about the flu, because I'm pretty sure someone is sitting there watching this video saying, but the flu has a vaccine, so we shouldn't be afraid of that. Well, I'm going to get to that in a moment. However, best way to prevent illness is to avoid exposure to the virus, meaning go out when you feel it's absolutely necessary. Or if you don't absolutely have to see a film, don't go to the theater. We should not be in a situation where we have the lowest box office in the history, pretty much, of cinema, because you have the fear and panic. I can't stress that enough. The over-exaggerated fear and panic instilled by the media and the government, having people too afraid to live their lives normally. The virus is thought to be spread mainly from person to person, basically like the common cold or flu. Hell, years ago, I went to go see one of my siblings in one of the school plays. I got bronchitis a day or two later because I was in the wrong place at the wrong time. That's it. It was person to person. I was around a sick person I did not know, and like this virus, like this mild virus, I got sick. And what did I do? I did what any rational human being does, and that is self-quarantine myself, get medicine for it. I went to the doctor because it ended up being bronchitis, and I stayed at home. That's what rational human beings do. I did not go out and hoard toilet paper because I thought maybe I might die. No, I said to myself, okay, I have this. This is what I have to do to get better. And this is exactly what the CDC is saying. This is what you do to prevent it, and if you get sick, this is what you do. So take steps to protect yourself, basically. Clean your hands often, which is what you should be doing during the cold and flu season. Wash your hands. Use hand sanitizer. I carry around a small bottle of hand sanitizer on me, even when I'm at home sometimes, but primarily when I go out. Because most of the time when I go out, I'm around a lot of people running grocery shopping or other errands. Avoid touching your eyes, nose, and mouth. Again, what you do during the cold and flu season. Avoid close contact with people who are sick. So basically, do your due diligence and say, do I absolutely have to go see that movie? Do I absolutely have to go to that restaurant? If you don't absolutely have to, don't do it. Just stay at home. But then at the same time, don't sequester yourself unnecessarily. Put distance between yourself and other people. So basically, again, if you can avoid it, do so. If you can't, if you actually have to be out anywhere, by all means, go. Just take the necessary precautions, such as like what I do, for example, and that take hand sanitizer with you. It's what I do. If you take steps to protect others, if you're sick, stay home. Really, cover your coughs and sneezes. Do it into your shoulder. Don't do it into your hands or anything like that, where people can touch you easily. Up here. You use a tissue, throw it away. Throw it away right away if you can. Wash your hands. Again, these are like steps that people take. Now, wear a face mask if you are sick. If you are sick, because I've seen people who are not sick wearing face masks because they're thinking it'll save them. And I'm thinking, you're a dumbass because we're all carriers of germs in some capacity. So basically, you are breathing the germs out and they're getting trapped in the face mask and you're breathing them back in. Let the hospital workers have those. If you're not sick. Because now they're having trouble getting them because you have the panic buyers buying those up as well, thinking it's going to protect them. It says right here, if you're not sick, do not wear a face mask. Clean and disinfect. Basically, again, what you would normally do during cold and flu season. Now, back to the vaccine, the fact that there's no vaccine for it, which is another reason these people are going into panic mode. And thinking, well, the flu has a vaccine, so I shouldn't be afraid of it. Oh, really? Oh, really? Well, look at here. Look at these statistics. 36 million to 51 million flu illnesses just from October to March alone. 17 to 24 million medical visits. 370,000 to 670,000 hospitalizations and deaths. 22,000 to 55,000. So even on the low end of that estimation for deaths from the flu, 22,000. Just for the U.S. alone. Look here. U.S. cases, 4,237 confirmed, 72 fatal. 72 people have died. Compare that to the 22,000 who have died in the same period of time, roughly. But the flu has a vaccine. You still die. If you have underlying health conditions, if you are elderly, you are prone still to either dying from influenza or dying from pneumonia, because that virus can morph into pneumonia if you have those conditions. You look at the global cases. Yes, they look high. They look high. Nearly 180,000 confirmed. However, the fatality rate is a little over 7,000. Basically, you have a 90-some% chance of survival with this virus. Because if you look at the recovered, it's about over 10 times that of the fatal. The numbers do not match the panic. They do not match the hype. And if you don't believe me, watch this video I tweeted if you're following me on Twitter. Dr. Drew blasts the fake news media coverage of coronavirus. He basically says they are at fault for causing this panic. They are at fault. He explains that the virus itself is mild. He explains that basically take precautions as you normally would, and blasts the media for their coverage. So, again, yes, it is a new strain. Yes, it is transmitted easily. But so is the cold, and so is the flu. Take the necessary precautions. Do what the CDC says. Do your due diligence. Be a rational human being. That's all we need to do right now. Because doctors, have come out and said, stop it. Stop panicking. It is a mild illness. We've had far more flu deaths than this new illness, but because it's new, it's all people are talking about. And they ignore the fact that 500 people, I think recently, have died from the flu. Again, almost 8 times out of the deaths of this coronavirus. This strain. That's it. And the reason why it has a 19 on it is because that's the year. So it's not exactly worthy of an epidemic at this point. But anyway, that's just my opinion. I'm going off the CDC numbers. I'm going off of just staying calm, doing what the CDC says. Stop buying into the hype, the exaggerated news generated by the media, because they want clickbait titles. They want people to panic because this is an election year and they have Trump derangement syndrome, most of them, and they want the government to look bad. So what are they going to do is they are going to cause a panic, and that is bullshit. So that's just my opinion. I'm going off the numbers. I'm going off what I'm seeing. I'm going off actually doing research myself and not just believing what the media says. But anyway, this is Mara Jade. That was my 2 cents on this whole coronavirus deal. If you choose to disagree with me, fine. That's your opinion. Let me know down in the comments what you think. Do you think we do need to be in panic mode, or do you think, yes, the media and the government are overhyping this? They are taking way unnecessary precautions at this point, rather than telling people doing what the CDC says, and that is wash your hands, take hand sanitizer, avoid contact. 3 things, if you can help it. But anyway, again, this is Mara J. This is my 2 cents, and I'll catch you all on the dark side, hopefully with the topic pop culture related or social commentary related. Thank you. See ya.